Good afternoon. I'm good to be joined by Dr. David Williams, Ontario's Chief Medical Officer of Health. We made a commitment to get your kids back to class. We said it had to be safe. And while this has not been easy on Ontario parents, on students, and on our education staff, I want to be clear that safety is what has and what will drive our decisions every step of the way. We will not put your child and your family at risk. We were the first to close schools in this country last March, and today we are the only province that decided to cautiously and gradually reopen our schools. Our Premier has been unequivocal. He will not put our families at risk. We know how critical getting kids back to school is for the mental health and the development of our children. But perhaps most importantly, while kids stayed home to learn remotely, and with the introduction of tough measures and the stay-at-home orders, for all Ontarians, we have seen a consistent decline in community transmission. With the full support of the Chief Medical Officer of Health and with the unanimous support of all local medical officers of health, Ontario is ready to reopen our schools because it is safe. Currently, more than 520,000 students across Ontario enjoy in-person learning. We will build upon that to get all elementary and secondary students back into class. With the support of the local medical officers of health in Toronto, Peel, and York, those public health units will return to school on Tuesday, February 16th, following the Family Day weekend. For the remaining 13 public health units, essentially all remaining schools, will fully reopen on Monday, February 8th. Again, in Toronto, Peel, and York, those school boards will reopen on the 16th of February, and for all remaining public health units, on this coming Monday, the 8th. We have been and continue to be guided by the medical community who have said schools were safe in the fall. In-school transmission was low, and nearly all schools remained open in the province. In fact, 8 in 10 schools had no active cases of COVID in December before we sent kids home for the holidays. Our protocols have been effective and safely protected students and staff, and finally, that kids need to be in school for their mental health. But we recognize the landscape has changed, and we will not rest. We will continue to act and add additional layers of protection to our plan to protect your child and our staff in our schools. As kids return to school, schools will be even safer, as we've introduced new and tougher measures to our plan to protect kids from COVID-19. Those include province-wide access to targeted, voluntary, asymptomatic testing that will be deployed by the local public health units for students and for staff. We've mandated masking for students from grade 1 and up, including outdoors where physical distancing cannot be maintained, and we've supported access to a higher quality 3-ply mask for our youngest kids. We've enhanced the screening of secondary students and of staff before they enter our schools, and new guidance, strong, clear guidance discouraging our staff from congregating before and after school, and likewise discouraging parents for their children to congregate before and after school. And to help stabilize our schools and to respond to a shortage of teachers across our province, we have allowed temporary certification of teacher candidates who are set to graduate in 2021. This will ensure we will have access to competent teacher candidates to deal with the very high levels of staff absenteeism. Ontario's Chief Medical Officer of Health and leading medical and scientific experts, including the Hospital for Sick Children, support the safe return to in-person learning for students and for staff. Under our plan, we are providing schools with more than $1.6 billion in COVID-19 resources to protect our schools. We've invested to ensure that nearly 100% of all school air ventilation systems have been checked, 95% of which have been improved, supported by 20,000 new HEPA filters, 20,000 additional portable air filtration systems installed within our classrooms in portables across the province. We've hired over 3,400 net new teachers with a plan to hire 890 more. We've hired an additional 1,400 custodians and cleaning staff with a plan to hire 400 more. 625 public health nurses providing critical supports for parents and for staff to keep them safe. And literally tens of millions of products and pieces of quality PPE, including 18 million surgical masks for our schools. We will continue to act, add new layers of prevention and investment so that our classes are safe for all children and all staff in our province. And I want to be clear, if things change, If trends move in the wrong direction, we will not hesitate to act, following the advice of the Chief Medical Officer of Health. That's why we're going to monitor the trends and continue to be in close contacts with the local medical officers of health to ensure we deliver on the number one priority of our government, which is keeping schools safe. I also remind families that your local public health unit always retains the authority to close schools to in-person learning if they feel that is required to protect their communities. That authority has always existed based on local circumstances and trends. I want to thank all parents for their incredible patience and support over the past very difficult weeks for them. I want to thank all students for their resilience and their energy to overcome really this great difficulty. And I want to thank our staff, our teachers, our ECEs, our EAs, administrators, and trustees, and all staff for their dedication and their effort in safely reopening our schools. I'm really proud of our province. We are going to get this right. We are going to safely reopen our schools, and we are going to protect our students and staff. And with your continued support and vigilance, we are going to keep community transmission low, and as a result, we're going to keep our schools open. Thank you. Happy to take a few questions.
We'll go to the phone lines for questions. Just a reminder, it's one question and one follow-up. First question.
From Chris Rushawi at the Toronto Star. Please go ahead.
Hi, thank you for taking my question. I'm just wondering if you can please explain what metrics you're using when you're determining which regions can reopen their schools, because not all of the hotspot areas are seeing a delayed opening after Family Day, and I'm just wondering why that is.
Well, I'll turn it to Dr. Williams. What I will say is we have consulted with the local medical officers of health in each of those regions to get their buy-in and their perspective on the right time to reopen, in addition to consultations with the school boards. And we're going to follow the local medical advice as much as we can, because we really do believe we need to take a regional approach, a granular approach, to make sure that we're responding with the right dates of reopening whenever it is permissible and it is safe within the community. But I will turn it over to the Chief Medical Officer of Health to provide context.
So if I understand your question correctly, since all of them are open, and we were prepared to open all on the 8th, but part of that is consulting with the local medical officers of health, and then they discuss things with the boards of education in each of their jurisdictions. And of course, the ones you're referring to that are moved to the 16th are the three largest ones in the province. And they want to make sure that, as we have from the get-go in the fall, there's a dynamic partnership between the local health unit and the local boards, including the schools and administration, so to make sure that all those things are in place for a smooth opening, and that there's different things besides the cases, but there's also things around related to the administration, classroom structures, and that, to make sure it's all in place well in order for a opening that we want to open and stay open. So all that is part of the overall teamwork that we've established well, a pattern in the fall, and we want to continue now through the winter and into the spring, because as the minister, and we've said before, when we open the schools, we want them to stay open, because it's very important to have all our children back in school and to keep it safe as it has been, and to continue to do that on the way forward.
Follow-up?
Thank you. Just given that there are new variants of COVID out there, why are we not seeing more of an emphasis on physical distancing and in particular smaller classes? Is that not important given how contagious these new variants are?
In our province, we have capped high schools for 75% of schools in this province at 15. I don't know of any province who has taken that action. We've hired 3,400 additional teachers with a plan to hire another 890. It's funded to hire 890. And now, because of a limitation, a shortage of teachers within the province of Ontario, we have now extended eligibility for second-year candidates, teacher candidates that are in their completing their studies to become teachers, to work within our schools, because we have disproportionately high rates of absenteeism. We have some boards reporting 40% rates of absenteeism. The consequence of 15, a classroom of 15 is roughly 35,000 teachers. We're having difficulty hiring 3,000 to 4,000. We have taken action to reduce classroom sizes in all the regions of the province, most especially in those that have increased rates of community transmission, well below the average, in addition to increasing more mental health workers, more ECs, more EAs, more custodians, all of which has been able to be achieved because we put in place $1.6 billion of investment, and we followed the medical advice every step of the way. What the medical community has advised me is it's not one action to the exclusion of others. It has to be a suite of comprehensive actions: improving air ventilation, providing PPE, mandating masking, the cohorting of students, the staggered starts of class and bus times. All of this, when you aggregate it, when you put it together, it's a plan that has allowed us to the present, facing incredibly difficult challenges in the fall and high rates of community transmission, certainly in November, December, when you compare it to September. And yet we were able to get our schools open. They stayed open. 8 and 10 schools, when we closed the schools ahead of the holidays before the break, didn't have an active case at all. That is a proof point that the plan that has been informed by the Chief Medical Officer of Health and been informed by the best pediatric experts in Canada has kept kids safe. And our intention with the new layers of prevention, with the new investments, the additional $381 million, of which $65 million can be used in part for staffing, to hire more teachers, more staff, to keep these kids safe. And we'll continue to do that. We'll continue to be informed by the science, and we'll continue to act.
Next question.
From Travis Danraj at Global News. Please go ahead.
Hi there, Minister. Hi, Dr. Williams. I think some in York, Teal, and Toronto are probably wondering what is going to substantially change over a handful of days of actual in-class learning when you factor in a long weekend and a PA day. But, Minister, if school is opening, the additional safety measures that you recently announced are not all going to be implemented in time. Also, the case numbers are not lower than they were when you closed schools. So what has changed since you closed schools for the ministry and the health table to now decide they are safe to open?
Well, I'll turn it to Dr. Williams to outline some of the data points, the trends, positive trends we're seeing both in the community rates and in some of the age brackets. But when it comes to new measures and the protocols being ready, I just want to be clear to parents. When we reopened schools in Northern Ontario, when we reopened schools for special education children of the past weeks, when we reopened them in Ottawa and London a few days ago, we were ready. With capacity for the PCR test, 25,000 has now been added, additional capacity to augment the existing system of testing within our province. Every one of those public health units, every one of those schools had the ability to have that testing deployed. I just want to be absolutely clear. And as public health units come online, open up on Monday, the 8th, and as additional public health units open on the 16th, be absolutely assured the PCR testing capacity, layered in with the antigen testing capacity for asymptomatic students, reaching 50,000 tests per week. It could reach up to 50,000 tests, as deployed by the public health unit, is ready. We are ready to reopen our schools based on that capacity. In addition, we have now changed the protocol for screening, for stricter screening for high school kids. We see still a high rate of positivity relative to the younger kids. We've now introduced that screening for staff and for students. We have mandated masking outdoors, where we've consistently heard from education staff themselves it's hard to keep the kids apart on the playground. So we've now said, look, to be cautious, especially in this rate of at a time of higher rates of transmission, we're going to introduce the mandate of masking outside. More funding for hiring of teachers, more hiring of cleaning staff, and an additional investment for air ventilation to further improve the air quality within our schools, particularly in some of those older schools in the province, triaging those as the area of priority. In the highest risk communities, as identified by some of our public health units, including in Toronto, we have the public health unit and the school boards have worked to have low classroom sizes. We're talking about classrooms anywhere between 10 and 15 kids. We are taking action in every single area to ready ourselves and to build confidence in the parents and the teachers and our staff that we can, as we have demonstrated to parents of this province, we can get your child back. We can do it safely, but it will require partnership. It will require the community transmission numbers to still remain low. We've got to keep our guard up. We cannot lose vigilance about what's at stake here, about our actions as a society and as individuals. So we've got to continue to play our part in the context of following the rules, the state home order, et cetera, so that we can get our kids into schools on the 8th and the 16th and keep them there till June. But I will turn it over to Dr. Williams to answer the earlier question.
So on the numbers, and you're asking about that, and it's a very important point, is that when we start down this road, we put in place the rules around the modified level 2. We did put the closure on Boxing Day and then a stay at home. And excuse me, if you look at the numbers and you see where we are now, with 1,172 cases today, when we're in the 1100s, this was early in December, and to see Peel under 200 today and Toronto under 500, we haven't seen that since earlier in December. So we are back before that time. That's still not good enough. We got to watch very carefully with our testing, and as Minister Lecce has said, the additional of rapid testing and more provision for public health, along with the targeted testing that can be provided, as we've already done up in Sudbury. That's going on right now. We want to detect these ones as soon as we can and try and catch them before they get into the school, because that's what we did in the fall. And as you know, we didn't have evidence of a lot of in-school transmission when there was a suspicion of it, with an outbreak declared, and we're in one case in the school or cohorts. Public health moved in either to close the cohort or to close the school until the investigation was done. But we didn't see a lot of evidence of widespread transmission in the schools. We want that to be the case now. And furthermore, now we have the addition of the rapid PCR testing for any positive cases that'll be vetted through to look to see if it's one of the variants. That's another question in the mind of the public. Is it something we're going to see? We want to make sure we're not going to assume it's not there. Let's go on the pretense it might be, but we want to catch it early, and be aware of that. So all these are new checks and balances in place, even as our numbers are now slightly better than they were just before we went into the seasonal break at Christmas. So we want to be on top of it, and we're going to keep on top to make sure the safety is guaranteed, for the parents to be informed, for the staff and teachers to be informed. Our schools were safe, our schools are safe, and we want them kept safe.
Follow up?
Thank you for that. I guess some would point out that the asymptomatic testing is voluntary, but given the importance that you guys have just highlighted in terms of having schools open and its importance to the economy, why aren't educators and school staff, like caretakers and administrators, considered frontline workers and on the priority list for vaccinations? Considering, lunch, for example, there are sometimes, 20 plus people in a room, and there sometimes is not social distancing. The kids are unmasked and they're eating lunch. And a lot of people say that that's not really different from a restaurant, which is closed for indoor dining.
Yeah, I do appreciate the question. I have noted publicly my advocacy for education staff, including our teachers, to be given preference in the vaccine rollout as part of phase 2, the workers essential to the economy, is sort of as it's termed. The decisions with exact precision on timing is really based on first access to the supply. We still need to get vaccination, to get the vaccine into our hands in Ontario, so that we can deploy it according to the broad schedule we have. But I've been clear that we want to see education workers in that. We have made that clarified that is part of phase 2. In fact, the example cited by Dr. Heyer was that teachers would be included in the next phase. That's important, and that includes for other staff with the work within our schools that I think is really critical. The first step, of course, is making sure that we get ample supply, and I think we're working with the federal government to get the vaccine in the first place now that we face significant shortages. In the context of staff congregation, it is a fair concern because, we have seen, according to local public health units, where sometimes no doubt unintentional, but where staff are congregating before or after school, or sometimes in some spaces like a lunchroom, a mask is removed, and we've seen cases or transmission that can occur. So we've been very clear on our guidance in schools, and particularly outside of schools, to limit and eliminate congregation and ensure the masking is maintained, distancing is maintained, because obviously it poses a risk to our kids and really even to the staff's families themselves, which we seek to mitigate. So we put in place clear requirements, part of the announcement we made on Monday, giving that guidance, sending out that expectation, and we'll continue to work with school boards and public health units to ensure we just don't see that happening on our schools. We just don't want to see transmission. It also emphasizes a new change for staff of screening, an active screening program. Before they'd be screened at home, do that self-assessment. They're going to be, and they have been, being screened actively, by a principal or a VP as they walk into the school, to ensure that is done, to ensure that They've gone through that list of symptoms, and 100% they feel good to get back into class. So that's the difference, the pivot we're making according to this heightened level of risk. And we're going to continue to build up those protocols. We'll follow the advice of Dr. Williams and the Chief Medical Officer. If they require more changes and guidance to the health to our staff, we will do it.
Next question.
From Anthony Fury at Post Media. Please go ahead.
Hi there. My question is for Dr. Williams. Just yesterday, over 100 doctors, many of whom were pediatric specialists, released an open letter calling for schools to reopen and to stay open. And they say in their letter that using community spread as a rationale to close schools moving forward doesn't cut it anymore. And instead, they're arguing that school closures will only be justified if it's proven that it's more directly harmful to kids to keep them open than to close them. How do you respond to that position that these pediatricians have taken?
So first of all, the comment by the pediatricians of how important school attendance is, we totally concur with. And my medical officers of health in the province have been strong advocates for that from the get-go. At the same time, we are concerned to make sure that with people and parents' apprehensions about potentially acquiring in school, we didn't have that in the fall, and we don't want it now in the winter and the spring. And so we think we can open now with safety in that. The aspect of schools contributing to community spread, we haven't seen that. We've seen that most of our cases were coming from the community. And just even some have opened up already, have identified a number of children who came already with some symptoms. They did not enter the school. They have been tested, and a number have been found to be positive. That's been our experience all along, and so we want to prevent that, because if you're doing everything you're doing as a parent and you're maintaining your household and all the standards, avoiding inappropriate contacts, etc., masking, all the things we've asked you to do, you want to make sure that when your child goes to school, you would like to be assured that the rest in the classroom have done the same thing and are not carrying it into the classroom. So we want what the pediatricians have in mind. We totally support that, and we have been waiting patiently to get that in place and all those checks and balances. And now we have, of course, the variants in place, which they didn't comment specifically about, but we have been informed by some other places in the UK that it has been found in children at a higher frequency. We want to make sure we're on top of that. We're going to assess that as we're doing right now with all our province, and we're developing new methods and techniques and testing to keep on top of that. So concur with what the letter, we want to do that, we want to do it again and do it better, and we want to make sure we are seeking their advice and direction, especially if we're dealing with variants and impact on health of children. We don't want to be the school the source of that. We don't want the community to be the source of that. That's why we want parents and everybody to be vigilant in what you're supposed to do and be careful and do that, because we have kept it down and we want to keep it down, not only just for the hospitals and the ICUs. We did this to get the schools open, and that's where we are today. We're successful with that. People of Ontario did what they're supposed to do over the last number of weeks. We've seen the products of that with our rates coming down precipitously, coming down even more next week. So we want to make sure they stay down and not rebound back up like we saw in some of the other centres, such as the UK and Ireland.
Follow-up?
Yeah, Minister Lecce, what would you say to those parents who are maybe applauding this announcement right now, but remember back in January they were told, oh, don't worry, we are reopening, and then a couple days later they were told, oh, no, we're actually going to close again. Parents who are happy right now, but kind of a little nervous that you might fall back on your word, at least for that 16th opening, which is 2 weeks from now.
I think my message to parents is that we're going to be guided every step of the way by the health and safety of their child. There just is nothing more profoundly important for a government to keep the most vulnerable in our society safe. We know schools have been safe. They are necessary for the development and the positive mental health of a child. We know that we have done this right for successive months with the vast majority of our schools in our province staying open, with the majority of kids not have active cases, literally 99.9% of which did not have an active case. 8 in 9 schools did not have an active case when we closed them before the holiday. What I can tell you is that we've done something right in Ontario, but it requires partnership. It also requires your government to listen to the medical experts, because at the end of the day, the decision point of opening schools or closing them in March or reopening them now in February is made on the best expert advice. And the decision to reopen today, endorsed by the Chief Medical Officer of Health, endorsed by the unanimous voices of all local medical officers of health, including the Council of Medical Officers of Health, and a variety of pediatric institutions, including Sick Kids and CHIO, who've called for the reopening of schools, who've suggested it is just so important we do it. So I'm going to continue to follow that advice. I assured parents we would do this. We would get our kids back, but it has to be safe. And we're at a point now in the community where we're able to do it with a level of confidence, both in capacity and in the broader public health indicators that exist. And I just want parents to know I'm grateful for their partnership, for their patience, and for the collective sacrifice they have made, wearing many hats. I know this has not been easy on them, and for their own mental health. And just if we continue to stick together and follow the public health advice, I know that their children will remain in class for many, many months and graduate this year, which is something we all want in this province.
Next question. This will be the last question.
From Caroline Alfonso at the Globe and Mail. Please go ahead.
Hi, thank you for taking my question. Minister Lecce, in your opening remarks, you said if things change, you won't hesitate to act. What does that mean? What is the threshold there to keep schools open, or conversely to close them again?
I'll turn it over to Dr. Williams on the data side, but what I will just say is a broad point. We are reopening schools because we have, as a society, sacrificed, followed the advice, and got the community transmission levels down with a downward trend that continues to be positive. So what I'm indicating is that because of our collective sacrifice, we've gotten to this place that we're able to reopen, in part because of that broader community reality, and in part because we've really elevated and enhanced the measures in place, the investments, and the expectations for students and staff as they enter our schools. Together, that gives us confidence we can do this again as we did in the fall to keep schools safe and to keep COVID out of our schools to the extent humanly possible. What I'd also, I think that principle applies to is that, look, our aim is to make sure schools remain safe. We have followed the expert medical advice of the Chief Medical Officer of Health and the local medical officers of health. If they give us an indication that there is a risk to schools, to communities, or to your child and to our staff, what I mean is I will not hesitate to act, because for us, this is a very clear message we're sending to the population. We're reopening because it is safe, but we'll take action if we do not believe your kids can be in school safely. But quite obviously, our preference and the whole reason why we've sacrificed for the last month as a province, the whole reason why we've been able to make incredible gains in reducing that transmission level and really keeping families safe, is to get our kids back and to keep them in schools. That's what we want here. And that's what we're endeavoring to do with more investment, with a stricter protocol, with a tougher screening regime, and obviously access to testing province-wide. Asymptomatic, it is voluntary, it always has been, and that'll continue with greater investments over time. So that's sort of the message I want to share to parents, that we will follow the medical advice every step of the way, both with respect to the metric. I'll turn to Dr. Williams.
So once we have opened, the process, as we've seen already, when we have the community transmission down, and we did so after the festive season break, and we wanted that week, the first week of January, to see did everybody adhere, and the answer was it wasn't well adhered to, and we had high rates. And so our only choice was to let the lower ones and the north open. And our approach now going forward with the case numbers down and doing with the strict screening and monitoring and testing is medical officers of health and their teams will do the case contact management containment type process. That means if you feel there is potential transmission within a cohort, you send the cohort home. And you wait till the testing's done or the incubation period is over. Then you bring them back again. If you think there's been spread of a possibility, not definitively known, the spread might be taking place in the school, either through students or staff, or you're uncertain, you will have the prerogative as the medical officer to say, at this time, we've asked the administration to close the school, everybody go home, while we test and carry out an investigation and be assured ourselves that the transmission is not occurring and we have kept it out of the school and send the school back again. So school closures, cohort closures will be done on a case-by-case basis, depending on the assessment of the local medical officer of health and their investigative team working in affiliation with the board, as well as the administration of the school. So that will be the ongoing process as we did in the fall. We're going to do it again now in the winter and into the spring. So that's how the schools will be all closed and opened based on the investigation, not on a number of metrics. If there is a concern, by the medical officer of health and their team that there seems to be a possibility of ongoing transmission in the school, they want to rule that in or out as quickly as possible, and you may have to close until the testing investigation is completed.
Follow-up? This will be the final question.
To avoid a repeat of school closures, many have said that there needs to be more stringent measures in place, such as physical distancing, particularly in elementary schools, where kids may not wear their mask well, for example. Why haven't you done that in elementary school classrooms in particular?
Announced some days ago that we're extending the masking requirement down to grade 1. Public health units and local school boards already have the capacity to drop it to kindergarten, which many of them in the high-risk regions have done on the consultation of their medical officer of health. We have in elementary schools, likewise in high school, classrooms that are well below the provincial average. We've hired 3,400 net new teachers, and let's be clear, we are on track to hire another 890. And to supplement the hiring of more staff within our school, we're now offering school boards the ability, if they can't find an occasional teacher within their existing roster, they can now pull or recruit a second-year candidate from the Ontario College of Teachers. They're finishing their degree to get into our schools to keep them open because we have a high rate of absenteeism. We have reports of 40% challenge of finding educators and staff to work in schools, a 40% absentee rate, which I think underscores the challenge of access to teachers. But we have increased the distancing. We have maximized distancing as a consequence of that hire. We have $1.6 billion in investment. We've improved air ventilation systematically in all regions of the province. We have taken action to cohort children. We have obviously enhanced the screening of children, particularly in the secondary and for staff, and we've provided clear guidance to students and staff as well, in addition to layering in the antigen testing, asymptomatic antigen testing, which is rapid, as well as the PCR test, both of which are not invasive for children. They're voluntary, and they allow parents to get, especially on the antigen side, an immediate result within about literally an hour or two. These are all new investments or new measures imposed to keep kids safe. We have followed the medical advice. We will continue to do that because the obligation of our government is to keep schools safe. And, I want to be very clear. In the fall, that plan that you cite, it was that plan in consultation with our frontline staff, public health units, the chief medical officer of health, that allowed us to successfully keep schools open. As sick kids said themselves, at a time of lower community transmission, that we did it right. The plan helped ensure schools remain safe. So it was that plan, that government, this chief medical officer of health, who introduced those concepts, who introduced those measures. And today, based on a changing risk factor, we've now enhanced them, not just in $381 million of more funding, but we've actually given school boards the ability with stricter requirements before a child enters a school, stricter requirements while they remain in school, on the playgrounds. And now we're asking families and staff when they leave school, when it comes to congregation. In every step of the facet of life, we're taking action, we're following the medical advice, and we will continue to do that every step of the way to make sure the children in this province remain safe.
Thanks, everyone.